profession of acupuncture to the practice of East Asian medicine, so that a licensed practitioner was known as an East Asian medicine practitioner. East Asian medicine is defined as a healthcare service utilizing East Asian medicine diagnosis and treatment to promote health and treat organic or functional disorders. An East Asian medicine practitioner may perform acupuncture, including the use of acupuncture needles or lancets to directly or indirectly stimulate acupuncture points and meridians, use of electrical, mechanical, or magnetic devices to stimulate acupuncture points and meridians, acupressure, pumping, point injection therapy, which is the injection of substances limited to saline, sterile water, herbs, minerals, vitamins in liquid form, and homeopathic and nutritional substances. And East Asian massage, as well as other modalities that are listed in the bill analysis. House Bill 1865 changes references to East Asian medicine to acupuncture or Eastern medicine. The profession is changed from East Asian medicine practitioner to acupuncturist or acupuncture and Eastern medicine practitioner. Acupuncture and Eastern medicine is defined as a holistic system of medicine, often referred to as traditional Chinese medicine, Oriental medicine, Eastern medicine, and other terms, which includes a variety of traditional and modern therapeutic treatments. An acupuncturist may perform this current scope of practice, as well as a number of additions and clarifications, including the use of pre-sterilized disposable needles, such as filiform needles, or other acupuncture needles, syringes, lancets, to directly or indirectly stimulate acupuncture points, including ashi points, motor or trigger points, intermuscular needling, and meridians, as well as use of electrical, mechanical, or magnetic devices to stimulate acupuncture points and other points. Point injection therapy includes injection of substances, including sterile water, saline, herbs, and local anesthetics. An acupuncture using point injection therapy who has met training and education requirements established in rule may also use oxygen, medical ozone, and epinephrine as needed for patient care and safety, as well as other modalities that are listed in the bill analysis. The education requirements for an acupuncturist are changed from a minimum of 2 years to a minimum of a 3-year master's level course. Statutes related to the approval of applications and requiring an exam fee, application of the chapter to previously registered acupuncture assistants, and the intent section from 2010 are all repealed. A person who is licensed as an acupuncturist may use the title acupuncturist, acupuncture and Eastern medicine practitioner, or East Asian medicine practitioner, as well as the letters LAC, EAMP, or AEMP. The Department of Health must adopt a rule requiring completion of continuing education requirements as a condition of license renewal. And throughout all statutes, East Asian medicine practitioner is changed to acupuncturist or acupuncture and Eastern medicine practitioner. There is also a proposed substitute from Representative Cody that's in the EVB. It does 3 main things to current statutes. It changes the name of an East Asian medicine practitioner to an acupuncturist or acupuncture and Eastern medicine practitioner, and changes references to East Asian medicine to acupuncture or Eastern medicine throughout the RCWs. It allows the Department of Health to set continuing education requirements for renewal of licensure, and it repeals the same 3 statutes that the original bill did. Happy to answer any questions.
I'll just say that the substitute takes out the questions of the scope expansion, but does the name change and the Department of Health licensure, because, yeah. And probably what we will have do with the scope is send it to Sunrise Review, the scope expansion. So, Therese Wolf, Jian Yang, and Ying Huang.
Good afternoon, Madam Chair. Members of the committee, my name is Karis Wolf. I am the Vice President of the Washington East Asian Medicine Association, and I'm a licensed acupuncturist from the state of Washington. Thank you very much for very much appreciate the opportunity to address important issues for our profession. We strongly support the substitute House Bill 1865, which will change the name of the profession to Acupuncture Eastern Medicine and allow our profession the ability to create continuing education standards for the Department of Health. Members of the Chinese community approached our association last September with a petition to change the name and eliminate the term East Asian, which was set in statute in 2010. We learned at this time that the term had historically negative connotations to their community. Members of the Chinese community brought this to us, and we then took it to the membership, and we were going to aim towards the title of acupuncture. There were a lot of members of our community that did not like just the title acupuncture because they felt that it didn't address the full system of medicine that we practice. So after 4 months of intensive negotiations to find a term that would be acceptable to the majority of the members of our association, we came up with Acupuncture and Eastern Medicine. All right. We went with Eastern Medicine for a number of reasons. We felt that it addressed the broader scope of our medicine because it includes herbal medicine, dietary, and exercise advice to promote health and well-being. And the term Eastern Medicine does not have historically negative connotations because it could counterbalance to the term Western Medicine and acknowledges the broader system of medicine that we practice. The bill does further define the term Eastern Medicine for the purposes of this chapter to include the specific countries from which the medicine has originated. Although the substitute bill does not include many of the clarifications that we requested for the practice of our medicine, we very much appreciate the opportunity to work with the chair and begin a sunrise review process in order to further evaluate our request. We are also very much looking forward to working with the Washington State Medical Association as well as other healthcare practitioners in order to come up with the best solution. Acupuncture has become more mainstream over the past 10 years. We have gained access to providing care in hospitals and integrated care clinics around the state. Acupuncture is also effective in treating pain as an alternative to opioids, and we look forward to working with the legislature to assure that the public has access to this safe and effective treatment across multiple healthcare settings. Thank you very much, and we would appreciate your support for the bill.
Good afternoon, Chair Cody and members of the committees. My name is Jianfeng Yang, and I am the president of Washington East Asia Medicine Association. I have been licensed acupuncturist in the United States since 1994. Prior to that, I was a medical doctor in China and began my practice in 1970, where I worked in the emergency room at a hospital for many years, practicing Eastern and Western medicine. And I taught acupuncture and Chinese medicine for 27 years in China and the USA. We strongly support substitute House Bill 1865, which will change the name of the profession to Acupuncture and Eastern Medicine. The association supports change of the profession title of our profession, which addresses the concerns of our Chinese medicine community, as well as incorporating suggestions from our board membership. The board has gotten feedback and discussion with all the involved communities, including our public policy committee, and we have reached a consensus that acupuncture and Eastern medicine best describes our profession and is in line with national terminology. For this reason, we strongly support changing the name of our profession in the bill. Many of Chinese members did not understand when the association ran a legislation in 2010 that they would change the name of profession to East Asia Medicine practitioner, and many did not speak up because of the language barriers of English as their second language. Now we have the opportunity to limit these concerns with this legislation. As an association, we are striving to be more inclusive and diverse in our board and to represent all of the perspectives of our membership. We highly appreciate your sponsoring this legislation and ask that you please help us by passing this bill during this legislative session. Thank you very much.
Thank you, Chair Cody and member of the committee. My name is Ying Wang, and I'm an associate professor and a clinical supervisor at Bastille University. I also have private acupuncture clinic. So I'm speaking today not from the university, but I'm a member of Chinese medicine community. I am testifying in favor of House Bill 1865. So this bill changes the name of profession from a term which is deeply offensive to people who live in mainland China. When China was invaded, the Chinese was called Orientals, segment of East Asia, or just East Asians, a name that continued to degrade Chinese people even today. I will not describe today the detail of what the Chinese people endured during the war, massacres and violence, which are difficult to imagine today. So these phrases may not be derogatory to you, but for those of us who have had to endure the racially charged connotation associated with them, they are painful to hear. They carry a history of discrimination and repression that should not be associated with our acupuncture profession. Both federal law and state law ban using the word Oriental when referring to people. It is time for Washington State to step up, then do the same with the word East Asian. House Bill 1865 changes the name of a profession to one which was developed and agreed to over a month of discussion in the profession. So we support the name change, and we ask that you enact House Bill 1865. Thank you.
Thank you. Katie Cohen and Melissa Johnson.
Good afternoon, Chair Cody and members of the committee. My name is Melissa Johnson, speaking on behalf of the Physical Therapy Association of Washington. We originally signed in a con on the original bill, and I've been checking this morning to see if the proposed substitute was in the EBB, and I hadn't seen it before today. So I appreciate the chairing for the proposed substitute. We did have concerns about some of the expansions that we felt were in the original bill. As the bill stands now, we are neutral. We have no opinion on the name change. We look forward to working with WIAMA and the other stakeholders during the sunrise process this summer. Thank you.
Madam Chair, members of the committee, my name is Katie Cohen. I'm here representing the Washington State Medical Association and over 11,000 plus physician and physician assistant members. I can refer to the comments just made, and we would also be neutral on the sub as written. Thank you.
I aim to keep everybody happy.
Except the members.
George Whiteside, Curtis Eschels, and Leon Wayne. I don't know how to say that one. Louise, Wayne?
Chair Cody, I believe they signed in.
Okay, all right. Glad you know.
Madam Chair and members of the House Healthcare and Wellness Committee, thank you for hearing Bill 1865 regulating acupuncture and Eastern medicine and considering the important amendment, making our primary title Acupuncture and Eastern Medicine Practitioner. My name is George Whiteside, MSEAMP. I'm a member of WIAMA's Public Policy Committee, and I was president of WIAMA for 5 years leading up to the passage of SSB 6280, concerning East Asian medicine in 2010. At the time, the term Oriental was deemed pejorative and outlawed for use in legislation in Washington State, which forced our profession to find a new term before the profession nationally had made the transition away from the term Oriental to a new term. The term Oriental is now forbidden in federal language as well, and is destined to fall out of use entirely in the English language due to its racist origins. It is only now that our national accreditation and member organizations have come up with the alternative name to reference our system of medicine. That term is Eastern Medicine. Since the Chinese community, a group who has contributed greatly to our profession, objects to the term East Asian and has agreed to the terms acupuncture and Eastern medicine practitioner, we are requesting that the term be updated in the statute one last time and reflected in our title. Acupuncture and Eastern medicine community in the United States, particularly here in the Northwest, is notable for the value it places on diversity, equality, and its ability to honor a wide variety of traditions and approaches to this medicine. There is no other state that has worked so thoroughly through nomenclature to honor all origins of this great medicine as we have here in Washington State. It is imperative to many of us that our title include both the procedure of acupuncture and the system of medicine name referring to the region where it originated and not just one country or a single modality of acupuncture. Therefore, I join my colleagues in urging you to pass Substitute House Bill 1865 regulating acupuncture and Eastern medicine and naming our title Acupuncture and Eastern Medicine Practitioners out of committee. Thank you very much.
Good afternoon, Chair Cody, members of the committee. My name is Curtis Escholds. I have been practicing acupuncture here in Olympia for almost 19 years. I'm also one of the former presidents of the association. I'm a member of the legislative committee, and I can testify that we went through a wide-ranging discussion about that name. It's a good consensus title to have in the statute, and I appreciate all of the testimony that's gone into supporting this. House Bill 1865 and the substitute do more than just change the name, and we certainly support the name change. It also leads the way for the Department of Health to create standards for continuing education. We think that's good for patients and it's good for the profession. For both of those reasons, the name change and the advancement of continuing education, I urge favorable action on the bill and the proposed substitute. Available for any questions you may have.
Okay, thank
Thank you
you.
so much.
Was there anybody else that had signed up that wanted to testify, or was it, because there's a few other names, but I don't know whether you actually just were in favor, or anybody else wanted to testify? Okay, if not, going once, we'll go to House Bill 1902.
Thank you, Madam Chair. For the record, Jim Washima, staff of the committee. House Bill 1902 deals with the number of premium invoices enrollees receive from qualified health plans. As you know, individual market health plans in Washington are currently required to cover abortion services. Federal law